Good afternoon, everybody. We had just a little bit of technical difficulty trying to make sure that our special guest was here with us, but she's here, so we can get started. Good afternoon. I am Attorney Danyl Patterson, candidate for the state rep seat in the 190th Legislative District in Pennsylvania. For those who don't know, that's West Philly, baby. So joining us today, we have Zahira Ahmad. You're coming into you now, darling. Get your game face on. There you go. There you
Can you see
Get
me?
in the camera, baby. Get in the camera. Turn around a little bit. Turn the camera a little bit. Turn the camera over. I got like a half of you.
Okay.
There you go, right there. Okay, see, I knew y'all could do it. All the tech wizards over there from PPP.
Wow.
Zahira, would you introduce yourself to the people, please?
Sure. My name is Ahira Ahmad. I am a 33-year healthcare professional, and I am here on behalf of Professionals for Progress, our movement, DKOD, and we are here to assist Daniel Patterson as candidate for the 190th. In
Thank
my
you.
career experience,
Thank you.
you're welcome.
Yes, you guys are avid followers of mine, and I'm so happy for the support of DKOD because you guys have been really great in the field, but also in helping to identify some issues that are going on in our community. Rob, can you still not hear me? Hey, Ava and Shelly, Gilda. There you go. Sorry about that. No, we weren't talking yet, but we are talking now. Can somebody just wave back, let me know they can hear me? I don't know. Anybody? Can you hear me, Zahira?
Yes, I can.
Okay, just making sure because they're saying they couldn't hear us, but we were still on mute for them because they didn't need to see everything that was going on behind the scenes, But this is what happened when we got to be, the writer, producer, the gaffer, and the the sound technician. But anyway, we've got some serious subject matters today because I reached out to Zahira because I'm really seeing what the New York Times said last week was a tale of two classes. And we're really seeing how it's playing out with COVID-19 and the response that we're getting here, specifically in Philadelphia. We're not even going to talk about the area. We're really going to talk about Philadelphia and especially West Philadelphia. My constituents are some of those who are being hit the hardest. And there are some reasons for that. I've kind of talked about it for the past week, even before like the New York Times article told us about, because I do try to be kind of ahead of the curve, trying to get the information out to the everyday people. But now I need you to come, kind of understand exactly how it's playing out, how it impacts us, and how we can start to make a difference. You on board, Zahira?
I am on board.
Okay, so the reason that the New York Times called this the tale of two classes is because there has been a very definitive difference in the way this quarantine has impacted specifically white versus non-white and rich versus the poor and working poor. And in my district, in 190th, you see exactly what's playing out because our demographic is so widely split. And the reason I say that is because we're right at the verge and in parts of University City. So what we have is where the residents live, this is where the nurses live, this is where the students live. And we have it surrounded by some different areas that where economically and educationally they're a little bit disadvantaged. Are you still there, Zahira?
Yeah, my video went out for 1 second.
Okay, but I can still hear you.
I can still hear you.
There you go. So, I'll explain. So, and what we saw last week when they finally started doing some testing and reporting on those numbers, we saw that the numbers, according to that map, and I showed you guys the map, according to the map, we are the hardest hit in the 19143, the 19139, the 19131, and then the other part is South Philadelphia, right on the verge of that. Now, why that's important in the 19104. And the reason that this is important is these are all of the areas in the map that are right around the University of Penn healthcare system. So some of the numbers that are being reported also include your back, Zahira. Some of the numbers that are being reported also include the healthcare workers that are responding to the crisis and those folks who live in the outskirts of or in the University City District. where people have more access to health care, people have their own private doctors, people have health insurance, people have the money necessary for copays. And why is that important? When COVID-19, when y'all president finally decided that we were actually in the middle of a health crisis, the first thing that happened was testing was only if you had insurance. I don't know if you know that, Zahira. It was only if you had insurance. So, and you needed a referral from your regular doctor to be able to be tested for it. So what don't we have? We don't have health insurance. And if we do have health insurance, we're not the kind of people that got a doctor that we can just call on the phone and be like, hey, I was coughing today and I think I might have a COVID-19. Our medical response, and we know this because Black people are just treated differently by the healthcare, society. And I'm actually going to really ask you to talk about that, Zahira.
Okay.
That we're just treated differently by healthcare society. So we're always considered to be, superwoman or superpower or super strength. Kind of like the opioid epidemic is because it was, some rich white ladies from the suburbs that was having pain after, they sprained their ankle or blew out their knee running. It wasn't like crack where some people went out and got some crack and then they were treated like crackheads. So there's a difference because it impacted a different demographic, a different response occurred. And so now, I could be walking into an emergency room literally with my leg hanging off, because this happened to me, literally with my leg hanging off, and had already been receiving morphine in the ambulance because I had ripped the entire thing off, broke every single bone in my so my foot was hanging off. When I got to the hospital, the attendant ordered morphine. And you want to know what the resident said? Well, no, you got to make sure she's not drug seeking. And the attendant said, you're going to give her some morphine and you're going to give her some more morphine. I mean, literally, my foot was hanging like this. But that's how we're treated. First, he had to make sure I was not drug seeking. I came in an ambulance, escorted by firefighters, the EMT, emergency response fire. And clearly I wasn't seeking drugs right there, but immediately they saw a Black woman, so you must be seeking drugs. But then the next thing they saw, when they come back and they fill out the health insurance, they found out I had fabulous executive health insurance, and then they found out I was a lawyer. And they wrote attorney on the top page of every single thing in my medical chart for 2 weeks. There you go. And that's right, Ava. That is why we do have Black primary care physicians and why we need them so. So, Zahira, so tell me what you know about, having been in the healthcare field for decades. I know, right? And she looked 25. It's so ridiculous.
Thank you. So, everything that Danyl Patterson has spoken about Blacks receiving treatment in healthcare is absolutely true. The moment we walk into any healthcare facility, we are looked at by our color, and if we are drug seeking, if we need medication. We often get misdiagnosed because of our insurance. Insurance plays a very important part in us receiving our health care. And that being, because as Danyl stated, once again, I'm going to piggyback off of some of the things that she stated, so I'm not repeating everything, but we lack affordable health care. Most of us in the underserved areas of Philadelphia receive Medicaid insurance, which is state insurance. And the doctors do not get excellent reimbursement from the state. So in terms of that, we get sub-service care. We do not have access to the private facilities because they do not accept these insurances. So a lot of times we'll go back and forth to the doctor 2 or 3 times before we get the proper diagnosis, where others go in and properly diagnosed right off the bat. So with this COVID-19, we was not able to seek the treatment because we didn't have the insurance. The state wasn't ready to pay for it. The state didn't want to pay for it. So we had to have some of the symptoms before they even allowed us to go in and get tested. And even with that, we still was not getting treated or diagnosed with the COVID-19 virus. And this is why our numbers are now escalating, because we were already sick in the beginning.
And when even in instances where you could get a test, one of the problems became, so let's say you had the symptoms and you went to a testing site. The testing sites were not open to the public initially. The testing site still required that your primary care physician send you to the testing site. So that meant that unless you had a primary that already had a health history on you, you still, even with symptoms, were not getting tested. So that means that by the time we started getting tested, we had already infected other folks. So what do they tell you? The reason they're telling us to stay at home is not because they want everybody in the house. They want us to stay at home and stay alone. Why? Because every single person that you come in contact with, you are considered like, so me and Zahira, if we were not at, onlinestudios.com, and we were together, it would be assumed that the two of us have now made 20 interactions of contact with each other, because I bring my 10 people and she bring her 10 people. And if she got her husband at home, she bring his 20 people to her 10 people. And now we got 30 people that Danielle has been exposed to. So that's the reason that they told us to stay at home and stay alone. This does not mean have a card party. Now I got to tell us, because apparently we're not getting it. Don't mean have a card party. It don't mean invite your girls over for happy hour and we just gonna sit at different areas of the table. It does not mean it's okay. My kids are bored. They're gonna bring their little friend because they play with them every day. It doesn't mean any of those things. If they are not residents of your household, they are not supposed to be in there with you.
That is true.
But most importantly, stay at home, stay alone, please. Don't mean go to the Platte and have a barbecue. Why is that happening?
We know about that, right?
Why is that happening? Why is that happening? So what happens? We already don't have primary care physicians. We're already looked at as being super strength or drug seeking. This doesn't mean, and we also, let's be real, we don't necessarily have the greatest history with our physicians. We know about Tuskegee experience.
Yeah, a lot of us do not seek proper treatment, and this is why one of the stigmas that we have in the healthcare facilities, because they are already looking at us like we don't care. So you need to build a rapport with your primary care physician at least once a year for a physical exam, so that when you do call for symptoms such as COVID-19, they know who you are. And this is something that we need to start doing. We have to start taking better care of ourselves as far as healthcare. And we are lacking in that area. And this is something, because we do not have affordable healthcare in our neighborhoods, the best insurance or no insurance, we seek the ERs for a lot of visits. This is where urgent cares came from, because they wanted us to not use ERs as our primary care physician. But if you don't have no insurance, that's what you're going to run to, is the ER. So that's one of the issues that we have here in Philadelphia and a lot of urban cities across America, the lack of insurance for Black people. So we get lack of treatment.
Well, so let's continue down that slippery slope. So one of the things that Ava Adama said is that's why I have a Black primary physician. And Ava, I will tell you, that's a magnificent thing. The problem is that even statistically, we are not represented in the medical community. So in the medical community, there are lots of Black people. We have lots of Black CNAs and we have lots of Black home health aides. We do not have lots of Black CRNPs. We don't have a lot of Black PAs. We don't have a lot of Black family practitioners, which is my next issue. They want to close Mercy Hospital, which is full of Black doctors and Black nurses and Black PAs and Black CRNPs.
And Black patients.
And exactly. And so just think, sadly, 2 nights ago, a lieutenant from the police department died. And in addition to, we had a nurse administrator from one of our nursing homes in our area in the 190th that passed away. They were both treated by Mercy. The officer initially, and then was returned back to work and then fell ill again and ended up at Albert Einstein. But the gentleman from the nursing home, Mr. Ali, had been treated throughout his course at Mercy Hospital. Imagine if Mercy was not still there and we were in the midst of our crisis. That's 100 beds that we would have lost. But most importantly, they didn't just want to go ahead and shut Mercy down. Specifically, the plan that they told us is they were going to shut down emergent care. And they were going to make it into basically a surgical ward. So like if you were having minor surgeries or those kind of things, then you would recuperate or coalesce and recover at Mercy. So they were going to make it into, or the plan is to make it basically not into acute care facility anymore. That is the primary hospital for many in West Philadelphia. It is a primary employer of West Philadelphians. And it is one of the places where you can find a Black doctor. Now let's talk about why those Black doctors are so important. Oh, yes. So Ava, so there's one. I was on the waiting list for 12 weeks to see her. There are even some specialties where you just can't, which contributes to the poor service to clients. Black doctors. Wayne, I would love for you to explain this a little more because this is interesting. So for those of you who don't know, so in my regular, being a lawyer job is I actually do catastrophic loss personal injury. Primarily, I sue doctors, hospitals, pharmaceutical companies, and nursing homes on behalf of injured individuals. So I deal with the bad drugs, I deal with the bad doctors, I deal with the bad hospitals, I deal with the bad policies. So, and I try to change them. So it's not always just about recovering money for the client. A lot of times my cases are about changing policies in hospitals. So an example is you don't get to hold yourself out as being a hospital and you are not capable of responding to a crisis, also known as Wills Eye Institute now. There were numerous deaths when Wills Eye Institute was still functioning as a hospital, or at least in our minds, we thought it was a hospital and people were going there for emergency care. So as a result, then Jefferson Neuroscience became the hospital. They're right across the street from each other. And people don't know how that came about, but it came about because of lawyers. And the reason I need to tell you that is because I'll tell you the truth. When our mother first heard what I was doing with my law degree, remember I told you, she said this law degree for us. The first thing she did was say, this ain't for us, she's trying to run my doctor away. And she didn't believe me until she came to one of my cases where the surgeon had actually taken out the man's wrong ureter. He had bladder cancer, and it was a wrong side surgery case. And after that, she was totally on board with, that's right, you need somebody to make these doctors do right. Because so that can change your mind then. But what happens is if we don't have doctors who look like us, who come from similar experiences, they have a tendency to write us off. Or a lot of times we say things culturally that mean something very different to the public at large. So like example, if you ask my dad how he was doing on any given day, he would tell you he's fine. He was a very typical Black man. How are you doing, Dad? I'm fine. Meanwhile, his arm is hanging off. Like literally, we're taking him to the hospital, and the ER came, and they were like, he's literally laying there. He had a hip replacement, and he had popped out of the joint, and he was sitting there chilling, talking about I'm fine. Meanwhile, anybody in their right mind would know he was not fine. But there was a Black fire rescue and there was a white fire rescue, and the white fire rescue was treating him like he was fine because he said he was fine. And the Black guy was like, no. That's called being a strong Black man, and we're going to get him out of here. So you have to know how to deal with the population you're serving.
Yes.
Oh, this is also very good. Can you respond to this one here for Charlotte? This is one of the reasons I asked at the start of the crisis, what about Black healthcare workers and professional representation, insurance and testing? Most African Americans prefer to see an African American doctor. What do you find in your practice there, Zahira?
Well, in my practice, the most recent practice that I was in, we only had two Black, one physician and one nurse practitioner. So when we looking to stay in our communities, to serve our communities, and see people of us like Black doctors, it's not there. We need to have more Black doctors, more Black healthcare professionals, if that's when we don't have many, and what we have, our choices are low because, again, insurance preferences. When you have these Black doctors who are working in solo practices, or some instances like Jefferson Hospital, a lot of their practices inside Jefferson Hospital does not accept certain PA insurance, which is state insurance. So we are lacking in many areas with that. It's not there. And until we can get more Black people to become doctors and nurses and stay in our communities to treat, we're going to always be lacking.
And Wayne, I'm going to actually come back to your question because that's interesting. Now, also in the health disparities, what we also have is the health disparities that are also a direct result of our economic disadvantages. Now, let me tell you what I mean by that. The COVID-19 test was a $50 copay when you had to have it. A lot of folks, even if they could get in, did not have the money for the copay. Black people are more prone, more likely statistically to be not just the working poor or to be middle class. Those people who are making the most money statistically in the Black population are our truck drivers. They're our skilled laborers, our truck drivers, our warehouse guys. They're our contractors and construction workers. They make great money, but they're also on the front line. And we've got to remember that they're on the front line. If you are the folks who are filling my Amazon order, you're still at work and I'm at home ordering from Amazon. That means you're on the front line. It's not just about the healthcare workers. If you're still, delivering my stimulus check, all the people worried about they're going to get their stimulus check. Well, I'll talk to the mailmen. They are scared to death. They don't have proper equipment either. But they're more likely to look like us. The folks who are stocking up the ShopRite and doing the back room at the CVS so that we can go buy all the hand sanitizer and that we're sending back there to go look for a thermometer, they're the folks that look like us. And as a result, they can't stay home. And guess what? They're also in Philadelphia statistically more likely to be using public transportation. So all the different possibilities where you can connect with the virus are being exponentially increased for this particular population. So I suggest this. Why aren't these hospitals giving out Uber rides for our essential workers? Why is ShopRite not saying, okay, so we need these folks? I'm serious. I am so serious. You told them don't use SEPTA. You told them they got to get there the best way they can. You know what? Instead of just saying that we're going to increase $1 an hour, because that's great. I mean, I think ShopRite said that now they're going to do $2 an hour more. They need to make sure these folks don't have to be on public transportation, because guess where the homeless who are not getting tested and don't have access are living right now? Anybody guess? Yes. They're living in the subways and in the L's.
So one of the things that I also wanted to bring into perspective at this present time was how the opioid crisis affected us. And as you speak about the homeless not being served or treated, one of the biggest things that the city was working on or fighting for the most was a safe injection site. That didn't look like us. This is why they were trying so hard to get this up and running. They actually focused on one specific population. It did not include us. I worked in that. Very few of them look like us, but the majority of the care was given to them. When we should have been focusing on this COVID-19, because it all took place at the same time, this city was too busy fighting for a safe injection site to go in South Philly, which has now the highest COVID-19 identified cases. They wasn't thinking about that. It was.
But think about this, Sahira. But think about this. But still see the problem with that. It has the highest number of COVID-19 identified cases, but not the highest number of illness and death surrounding COVID-19. Right. They're getting the test they need. They're getting tested at not at their percentage rate. They're having access to the testing. Think about it. Look at where the deaths are coming from. Look at where the hospitalizations are coming from. It's not that demographic. We have to look. I'm just saying, we just have to look at the big picture for all of us to see how this city that we are all paying taxes into, to see about us, this state that we're paying taxes in to see about us, is not seeing about all of us.
It wasn't. It was the
Now,
broader.
what else do we have economically going on? So
Yeah.
now we've got people who are choosing between eating and their health care. Why? Because they done lost their jobs. And President Trump doesn't want to expand Obamacare enrollment because, God forbid, because it's Obamacare. He has spent 4 years trying to dismantle it. God forbid Obamacare be what save us all. So that's problem number one. Our state system is already stretched, and the websites have all crashed. So I done spent 5 days, 6 days telling all of y'all, giving you the links to all the websites. The UC benefits website has crashed. Compass PA, which gives you your emergency Medicaid, Medicare, Medicaid and SNAP benefits, that's crashed. The Phil Abundance has COVID-19 cases. They can't get the food out. And and again, these are all the people who are at most vulnerable communities. The website from the federal government that was supposed to go up so that these seniors, they could get their addresses and bank accounts online so they could receive their stimulus check, that's crashed. None of the things that we need in our very vulnerable community do we have. But that's because we're real good at passing laws, but we're not real good at planning for them. There was an emergency, and I'm going to tell you right now, in 2 years, all we're going to hear about is we did the best we could with the information we had. And I want y'all to remember, they had the information. They had the information. And I'm going to keep coming back to it in 2 years and remind you, they had the information. Trump told us in January it was a hoax. He told us in February it was a hoax, and he continued to golf. Now he's trying to blame it on the impeachment, but you was golfing. I don't know. I don't know.
I have one question for you, Danielle. As you run for Pennsylvania State Representative for the 190, what are some of the changes that you plan to bring to help us better than you? You're already doing an excellent job at this, and I thank you for it. But can you tell us some of the things that you aiming to change for us as far in this area for where we lacking at?
Well, let's just talk about the COVID-19. So let's just talk about our health disparities right now. Okay. So first of all, we can't have all of our insurance tied to our employment. We see this does not work. We need to come up with a system where our benefits are not exclusively tied to employment. If that, and it doesn't even mean it has to be free. If we have to have an opportunity to pay into a fund, then we can do that. But what we know is they told us before, well, if you lose your job, you can pay into COBRA. Well, we all know COBRA costs too much. I don't have $800 a month. Okay, especially if I'm receiving unemployment compensation. So that's one. Number two, talking about that unemployment compensation, it needs to be readjusted specifically with like a per diem addition paid to folks who are in Allegheny County and in Philadelphia County. Almost 60% of the revenue out of the state of Pennsylvania comes out of Philadelphia County, but we don't get our money back in the same at the same dollar for dollar. We're giving our money to Wilkes-Barre and Scranton, and we're giving our money everywhere else, but Philadelphia doesn't take it the same amount. And the reason this is important, $600 a month is how much unemployment benefits max out at. You cannot live, $600 a week, so $2,400 a month. So it's designed for somebody in 6 months who makes $34,000 a year. You can't live on Philadelphia. You can't live in Philadelphia on $600 a week. We know that. And as a result, we need to get some kind of addendum so that we get additional monies that are adjusted for the inflation that is our area, so that we can be able to sustain in times of crisis like these. The same as our food is not as inexpensive in Philadelphia to get. So to say that, okay, everybody in Pennsylvania gets $231 in food benefits, though that $231 goes a lot further in Harrisburg than it goes in Philadelphia County. So there needs to be some kind of supplement added because of the county in which you reside. It's also one of the reasons that people have started moving out of Philadelphia who receive benefits, because they've realized they can go to Boothwyn or parts of Montgomery County. They have the projects and assisted livings there that make it so that they can exist on the amounts of money that these things are already given. That, and then number three, and this just is all by all. And I'm going to come back and finish up with nursing homes, because the nursing homes being the hotbed of care that they are, and the hotbed for COVID-19 right now is ridiculous.
Yeah.
And I'm going to tell you why I actually told everybody this is where we're going to have our biggest crisis. We have laws that have been put in place around medical negligence, around JACO, the standards for hospitals, around licensing credentials for our doctors and our nurses in our hospitals. And you know what? They largely go unenforced and ignored. Why? Because the lobby is as strong as the gun lobby in other parts of the state. And as a result of that, that's the reason that Black women die more often in hospitals having babies. That's the reason that Black people don't have, we don't get the same response that they do in the ER, that we're sent home 2 and 3 times before we get care. The Patient's Bill of Rights only says that we are entitled to be stable, but nobody determines exactly what stable is for the benefits of being able to be released. The other thing is that our treatment in the emergency room cannot be tied to insurance. And they tell you it's not. Yes, it is. That only means they have to stabilize you. And that's why I come back to that part. If all they have to do is stabilize you, well, you know what? So remember when I told you my ankle was falling off? Well, technically, if they put a splint on it, it wasn't falling off anymore. So I was fine. I could have went home. That's stable. Well, you know what? I have an ankle that has been detached from my body. The likelihood that I could have gotten blood clots and died the risk was increased exponentially. And if I didn't have the health care that I did, they could have sent me home. That is not being stable. So we need to, across the board, determine what those things are that qualify you to be treated in the ER. And all that stuff about, oh, we treating all of them equally, I'm going to tell you. Because no sooner than they put the splint on me and gave me my plan of action, guess who the next person I saw was? I'm in there doped up off of everything, because they now gave me, I think I had moved all the way to Dilaudid. And so if you don't know what that is, allegedly it's 20 times more powerful than morphine. And I barely keep my eyes open. And somebody came in and told me sign my life away. That's when they came to me, because I was by myself. My parents weren't there. You know, I didn't have anybody with me. I was brought in an ambulance. That's when they told me to sign my life away, and here you go. And all they wanted was my social security number and my date of birth so they could confirm I had some health insurance. That's what they wanted. And then when the next person came back, all of a sudden you're fine and you can be to a room. And not only that, you get a private room, but that's all the rooms with private. And that's problematic. We need to, it does not matter if you are Danyl Patterson, the lawyer, or Danyl Patterson, the drug addict. I need to be treated with respect. I need to have my health issues addressed, and everybody is entitled to that same level of care. Hey, J-Dub, how you doing? So that's just around this COVID response. I have a whole platform, and we're actually going to do a whole show just about my platform, because it's really time. I've been playing nice guy because we got a problem that's in front of us, and right now the part of leadership is showing that you can lead, not just campaign. So I'm just out here trying to help folks through this, because I'm right here with you. But we're gonna get back to the campaigning. Don't worry, Zahira. We're gonna get back to the campaigning. And then now I'm just going to finish it up with nursing homes, because these are the folks that I'm the most concerned about. We know in Washington State, we know this, the very, very first crisis point was one nursing home in Washington State. And we saw how quickly the virus spread in that nursing home. Well, let's see. It's the perfect storm. We got a senior population with comorbidities. They got high blood pressure, diabetes, MS, Alzheimer's, lupus, and every, they're recovering from cancer. They all kinds of things going on in these nursing homes, right? They also are immobile, so they can't go anywhere. A lot of times they're in walking boots, or they need assistance to get in and out of bed, and they're incontinent. So that means that they can't control their bowels, they can't control their release at all, and that means they're more open to infection. They can sit in infection. In Pennsylvania, we don't enforce the nursing home laws, and I'm gonna just say it and call it what it is. And you can walk into any one of these nursing facilities on any given day, and you will see 40 people in 40 beds and 2 CNAs with 1 RN on 2 floors. who only come to get med.
Lost it on here.
Three of those folks, three of those patients are now their and that's the thing because I'm getting all the feedback on your end.
It's locking my screen on that one. There. Okay.
Here you go. I'm going to mute your mic, honey.
I'm
You
losing
back?
volume.
Okay, they messing with volume. Sorry about that. So if you have those people, those family CNAs are now treating those people on their own care, what's the likelihood of infection? The other thing that we know from the Washington State folks is that the CNAs actually brought the disease into the nursing home because they worked at other facilities. They had other interactions. We already told you about me and Zahira and our 20 different interactions just between the two of us. And now what happens? You've got this vulnerable population and one person gets infected. Those same two CNAs who are overworked because they're understaffed. Can you imagine what it's like to care for, provide all the care for 20 people? So it's 40 people and I got two. For 20 people in one 12-hour shift. Can you imagine the kind of demands that are being put on them? Well, I imagine them because I go to nursing homes all the time. My mother, unfortunately, was in one before she passed away, was in a facility. And what I did was I visited her at random points of the day, every single day. And the reason is because I know that as long as they couldn't track me, she got continuous care like she was supposed to.
Right.
If they knew that I was only going to come on Thursday between 2 and 4, then that Thursday at 1 o'clock, she'd get fed and bathed and changed, and that they wouldn't see nothing else from her until Monday morning when they knew I was going to come back. So the nursing home guidelines say that they're supposed to staff at a higher ratio. But when they don't staff at a higher ratio, guess what happens? They get cited, and then they get an opportunity to fix it. Well, when they get the opportunity to fix it, all it is a written report. Nobody ever comes out again and says that you actually have that staff there. So what they do, they hire temporary staff. And I know y'all all hear about the temp nurses at nursing homes. You hear about them. And so what happens? Okay, so I'm nurse administrator, and I done sent this to the board, and the board says that's great. We haven't expanded the budget any. We haven't actually put anybody permanent on the books. But when we sent it into the state, we had those folks there. And now guess what? 6 weeks later, after the state approves it, we write back to our 2 CNAs for the 40 beds. These folks aren't getting turned. They're getting pressure ulcers. That means there's a new means for infection to get into their body. There's so many different ways. It's not just about the contact with the CNA. What do we know now that we didn't know beginning, allegedly? We know that this thing is probably, more airborne than we thought it was. We know that the virulent drops can get on anything. We know it can live on clothes. We know it lives on metal surfaces. We know it lives on paper. We know it lives on, on steel. It lives on all those things that viruses typically don't, or that they die quickly. And as a result, we can take them from one to the other. Yes, sorry, I can't say your name, baby. I'm sorry. I'm not going to even, Miss Hodge, I'm going to say that. There you go. Yes, the agency nurses. The agency nurses, and hey, this is the thing. We're relying upon those agency nurses right now everywhere. We're relying on them in the hospitals. We're relying on them in the nursing homes. So I'm not here knocking them. I'm saying that it is a healthcare worker's right to be protected. They should have their proper PPE. They should not be overworked. That they're extending these staff hours the way they are means that they're putting everybody at risk for danger. That means there's more mistakes. There's going to be somebody who doesn't put their mask on right because they're calling codes 3 and 4 times a night, allegedly, at University of Pennsylvania because of what's going on. In New York, there was a nurse on CNN who said that she's been up practicing PA now, physician assistant, CRNP, for 25 years, and she's never seen this many codes called. She's like, I can't even get, unrolled from one before I'm getting rolled for another one. That means mistakes are being made and cross-contamination is occurring. That's a workers' right issue. And that is something that our state level needs to address. Now I've been on my preachy mode. So give us some more examples out here. I'm sorry.
It's okay, but you're exactly right. As the numbers increases and they don't have the proper healthcare workers to adequately staff these facilities, we are going to have more healthcare professionals with positive cases because, like you said, you work 12-hour shifts, you're tired, you're forgetting to put a glove on, or you're not putting your mask on properly. And it happens, especially in hospital and nursing homes primarily. Those CNAs are really overworked. And you are exactly right. They only staff when they know their state inspection is coming. And as soon as their state inspection is gone, all the agency nurses leave, and you don't have another state inspection until the following year. And everything that was going on beforehand continues to exist. It's just sad that we are in this situation, and these people on the front lines are the ones that's primarily are the ones that's being affected the most behind it. So, PPE equipment. I was online just doing some research, and McKesson is one of the biggest suppliers for the hospitals. They're completely out of stock for masks, completely out of stock for gloves. How are your healthcare professionals supposed to work adequately when they don't even have the proper equipment ordered from the most biggest medical supplier to these hospitals? It's just ridiculous.
It's an ongoing crisis, and we'll be here to make sure that you are up to the minute, hopefully in plain language terms. But I'm just going to give you some, ideas on some things that you can do at home. First, make sure that you have somebody that can advocate for you, not just yourself, but somebody that can advocate for you. Make sure that somebody is with you that actually has access to your medical information, that knows what your underlying conditions are, knows something about your medical history. Because unfortunately, and we're going to talk about this a little bit later on, is that as people don't forget, you're going on ventilators. That's what's going on when people are coming down with this crisis. They're going on ventilators, so they can't make decisions for themselves. They can't talk. So you need to make sure that you're surrounded with someone who can provide that pertinent information and respond to your crisis. That's number one. Number two, I am going to ask you all to stay at home and stay alone. I know it's hard. I know it's boring. Zoom with me if you have to. Tune in at 3:30. Send me an inbox about some ideas you have. If you're having questions and your sites are going down, you're not able to get the information, please make sure that you reach out to my staff. They're there all the time responding to questions. At least we could tell you that the UC site was down because somebody actually, they called it a panic. I don't know what's going on. I've been trying to, I can't. And I had to tell her it's been down for 3 days. So, and also that the mail is more than backed up for 10 days. So even if you did an initial filing, so if you were somebody who never received UC benefit before, they have to send you a PIN to be able to access the PAC, the Pennsylvania Teleclaims access line, either online or on your phone. If you don't have 4-digit code, you can't access PAC. So, and the codes are not coming back. So that's problematic, but people don't know that. And when you don't know, you're more afraid. So if you need information, even it may not always be the best information. Like I can't say your check is on the way, but I can tell you why it's being slowed up. Please reach out to us at 267-291-4702, 267-291-4702. Also, I am going to ask you if you come across any additional information, one of those things today, Charlotte, I always forget the 3 names because she got 3 names, baby. I'm sorry. Wait a minute, don't get mad at me, Charlotte. It's 3 names. It's 3. I want to make sure I got them all right. Hold on, because she likes all of them. Greer Brown, because I was going to say Greer. Okay, I know it's 3 names. Charlotte Greer Brown, she shared a resource with me this morning to let me know that testing is fully open at West Philadelphia High School. For you folks out there in West Philly, West Philadelphia High School has testing. And I do know that, just from driving that way at 41st and Market, the tents that were put up for COVID testing that were originally only there for hospital and nursing staff and students at University of Pennsylvania has been opened up to everyone. So anyone can go to 41st and Market over there in the tents. You know what a Rite Aid is. Y'all know what that Rite Aid is. Don't act like you don't. You live in West Philly, you know what that Rite Aid is. You can go, you have any signs or symptoms, if you've come in contact with, you've been caring for anybody who has tested positive, make sure you get over there. You can get a test any day between 10 and 2. Monday through Saturday between 10 a.m. and 2 p.m. So make sure you share those resources because we don't always know. In addition, if you need some food, there's going to be a food giveaway on Thursday. They're trying to confirm the exact time and they're going to do online registration for it. So that way we're trying to limit your social contacts. But I'm going to say to you, unless you absolutely need any of these things that are being given away, absolutely, because this is going to be what they say, this is going to be hell week, for no other way to put it, is that we're going to see the surge. Like it's not going to be the purge, it's going to be the surge. We're fully expecting the numbers to double and triple daily as to actually numbers of who are coming back infected, and the fatality numbers are expected to double and triple this week. So I'm just going to say to you, unless you absolutely need this food, unless you absolutely need to go and go to the CVS, unless you're picking up life-sustaining medicine, this is not the time to venture out because you need some echinacea. Okay, if you don't have the echinacea already, you don't need to get it because you're not going to boost your immune system before the day after, and you just statistically you need to have that in your system for a while already. So don't go out and risk your life to get sea moss from your girlfriend today. Okay, I need you to stay in the house. Try to eat your lemons and make your alkaline water and whatever else it is from the stuff you already have in the house. But I'm also going to tell you the same thing I do every single day. Try to check on two people. Just try. Two senior citizens, some folks who might have a health ailment, who don't get out often, people that you like, on my block, there's a gentleman who orders every single day. We know he's basically a shut-in. I made sure I sent him food, and put it in his porch so he could come get it. And we call somebody on the block, checks on him every single day to make sure it's something that he, if he needs something, it can get to him. And we're not getting it from stores, baby. We get it out of each other's houses. Okay, well, I got some, you need some sugar, I got some sugar, let me bring you some sugar, and let me go back in the house. Okay, so Zahira, any last words?
I just wanted to add to the testing site. I've seen that along with University of Penn, Jefferson also added. I'm not exactly sure where they are doing it, but the number to Jefferson, if you want to find out, is 215-955-6000. And you can ask them where they're doing their testing site. But I did see that they was added on the list along with University of Pennsylvania as one of the testing sites.
Oh, and David, to respond, yes, we know that no one is allowed into the hospitals. That is actually true. They're not letting you into the hospitals. However, you can still access emergency care. If you have to go to the emergency room, they will take you into the emergency room, but they're going to take you by yourself. So it's not you and somebody else, okay? So because they're trying to limit the number of people who are exposed, because the likelihood that you go into an emergency room and somebody else in there has been exposed is very great. So yes, don't feel like you can't get emergency care. Please, if you in the midst of having a heart attack, call 911. If you're having chest pains, you can't breathe, call 911. Don't think this is a time that, I had to be a kitchen beautician this weekend. I don't want, the WebMD doctors, okay? Take care of yourself. Now, I did. Oh my God. I'm going to talk to y'all about being a kitchen beautician. Child, y'all should have seen me with this eyebrow. It was a whole hot mess, but that's a whole nother live for another day. Zahira, thank you so much for coming on. We need to hear from our healthcare professionals. They are our first line out there. They're working hard for us on all sites. Yes, David, you have to advocate for yourself. That's exactly
the same thing. We have to advocate for ourselves as well as to others, especially your parents and grandparents. We have to actually be the advocate for them, because they are intimidated when they go to hospitals. They don't like hospitals, and they feel like they're being talked at and not talked to. So please be an advocate for your mother, your father, your grandparents, and just, be careful, be cautious, but also be smart and wise in your decisions. Thank you, Danielle, for having me on. I appreciate it. Any questions that you need from me later, please feel free to call me as you always do, and have a good afternoon.
And this is Danyl Patterson, attorney and candidate for state rep in the 190th. That's West Philly, baby. And we'll see you tomorrow as we talk about the SBA loans, why we're not getting them, and how the site crashed and what to do next with Deneen, attorney. I never get her name right, so she's gonna tell you tomorrow because I can only write it. It's like Waislick. Pashuco or something. I know her though. See, I got girlfriends from all over. So my Tampa attorneys are going to weigh in for this one. So we'll see you tomorrow right back here at 3:30 on live. It was a good day. Good talking with you. Thank you and goodbye.